Hello, and welcome to Rolling Out's Health IQ. Today, we are talking with esteemed dentist, Dr. Maryann Riordan, who's a DMD, and she's also the owner of Harlem Dental Associates. Welcome to the show, Dr. Riordan.
Hello, hello. Thank you for having me.
Absolutely. It's always a pleasure to have back people who we revere in such great light. And you always welcome our community to ask questions, to give us the best information that you have, and to also just educate and inform. So thank you so much for that.
Yes, I'm happy to do it.
So today we want to talk about how COVID-19 and the pandemic is affecting the dentistry world, right? So can you touch on how some of your patients that you've seen have been affected by oral health?
Well, when we first spoke a couple months ago, at the beginning of the pandemic, we were talking about how the access to care was a thing because people very concerned about going to the dentist, the vulnerability that people felt, the fact that could I get COVID if I go to the dentist, right? It kept a lot of people away. The good news is that there are no real direct links between the virus and actual dental disease, but the fact of we've been neglecting our dental health, that is what we're seeing playing out. So when people don't go, we find more, gum disease issues and sometimes more cavities creep in. So we're trying to get back on track, reset a lot with a lot of our patients and get back to stable ground and, fix those problems that were lingering for a couple of years now.
So what do you tell people who have not been to the dentist because of the pandemic? How do you ease them back into going to the dentist regularly?
Yeah. So, I'm so grateful to say that our office and a lot of offices, many dental offices out there, we listened to science. We acknowledge that we are in a vulnerable situation, not only ourselves as healthcare providers, our staff, and our patients. The virus lived in our mouths, in the oral cavity. And when the pandemic hit, there was a lot of CDC guidance from the American Dental Association, and a lot of scientists recognized that vulnerability and helped us figure out how to perform these dental procedures in a safe environment. So we definitely stress to our patients what we have done. They see us, they know, they come in, it looks different. We're all covered up. I feel so sad that some of our new patients within the last year or two, they don't even know what I look like except for these eyes that show out, But the point is, they see the protocols in place. We talk to them about how, we are taking a lot of different precautions. And from top to bottom, we do practice differently. And that has kept our patients safe.
Wonderful, wonderful. So guys, if you're contemplating or apprehensive about going to the dentist, Dr. Riordan is here to tell you that you shouldn't be. Like, there are other issues that affect our oral health and our mental health when it comes to this pandemic. So that's the next topic that I would like to talk about. Can you share with us how the medical mental health has been as it's associated with dentistry?
Yeah, a lot of people underestimate the connection that a dentist has to have with a person's mental health. Fear is a huge barrier to a lot of dental procedures. Patients don't come, they're afraid, So as a dentist, I certainly recognize that fear of a lot of different things could be an impediment. So we try to manage people's fears. Also, mental health as it relates to a person's self-esteem, with their smile and the lack of teeth or whatever they maybe lack confidence in, that plays out with mental health. And there's a direct connection to your oral health, so we definitely recognize that. We try to help patients overcome. But with this pandemic, one of the most impressive connections to that mental health and dental relationship is the significant amounts of stress that we've all had to endure with this pandemic. Our lives have changed in so many ways, and how it's playing out as we see in our offices every day is a lot of times people take our stress out in different ways, and sometimes it's with grinding or clenching your teeth. And patients might not be aware of it. They often do it unconsciously. A lot of times people do it in their sleep. And so you're unaware of this habit. You're taking all this stress in. You're doing this damage to the teeth. And then we see you at your checkup and we saying, are you grinding and clenching your teeth? Oh, no, I don't do it. But then another tooth is breaking. The enamel is wearing down. Patients are reporting a lot of headaches, jaw pain. And this habit, we call it bruxism, is something, once we have that conversation, there are different strategies, but it is manageable. And and by managing it, we can prevent a lot of other major dental issues that can come about.
Wow. And you described it as bruxism. Can you elaborate on what bruxism is and how we can avoid it?
Yeah. So, bruxism, that is this broad term, a diagnosis for a person that has this involuntary muscle contraction of these muscles that open and close your jaw. And often it's done while you're asleep. So you don't know you're doing it. Often it's stress related. And it's, once again, an involuntary habit. There are a lot of people can put this not a lot of people. There is research that supports this is in a category like restless leg syndrome or sleepwalking or sleep talking. Your muscles are going and you don't even know it, right? So that's what the habit is related to, muscles.
Wow. And so how would I know that I have bruxism? Do I have to come into, say, an office such as yours to find that out? Because like you said, sometimes it happens when we're sleeping. So how would I know?
Yeah, so often it's that conversation with the doctor. Most people are asymptomatic. They don't have symptoms. They don't feel anything. But when you go to your dental checkup, we have different ways that we can monitor a person's shape of a tooth, because as we get older, the teeth can wear, they can reshape on their own because of that wear pattern. And then so we're seeing, oh my gosh, look at that tooth. It didn't used to look like that. And now here we are, 5 years later, and it's changed. And often that's that conversation. But there are some patients who suffer with some headaches, chronic headaches, and they don't make that connection. Is it something that I'm doing with my jaw? Is it dental related? So if you have symptoms of headaches, jaw pain, if you have an inability to open and close your jaw, sometimes people are so stressful on that jaw joint that they can't open so wide. And if you've seen changes with that, it's often this habit, clicking and popping of that jaw joint. And then sometimes it's tooth pain. Sometimes it's a real discomfort or soreness on the teeth or on the jaw. And then that patient, oh, my jaw feels tired. My teeth feel sore. Well, you don't have a cavity. You don't need a root canal. You're grinding your teeth, So that's how we can have those conversations.
Yes, you brought that up, and now that I'm thinking of it, my son, he often complains of headaches, and so he's had the braces and all of that, but that definitely might be one of his issues.
Could be.
Yeah, I'll have to ask him about that. Now, before we go further, I do want to say hello to Facebook. Facebook is chiming in for you. So Sarita Oglesby, she said, hey, Dr. Maryann Riordan.
Hi, Sarita.
And then she said, congratulations. Anthony White said, Dr. Riordan is the best. I fly from California to Harlem for my dental work. Okay.
Yes.
Best customer and dental service. That must be some service.
We try.
I love it. I love it. 5-star service. Helen Shelton is in the comments. She says, repping Harlem, USA. Gerald Johnson says, blessings of the Lord to you. Awesome, amazing, powerful, treasured woman of God. And Maryann Norman says, hello. And so this would also be the time that if you guys have any questions to Dr. Riordan, put them in the chat and we will be monitoring them, and I'll feed these questions back to Dr. Riordan. So if you have any questions, put them in the chat. Now, we were also talking behind the scenes about how this pandemic is keeping people from not only seeing a dentist, but a doctor and a psychiatrist, and affecting their mental health. Can you expound upon some of the articles that you've read lately in the New York Times that helps us to understand what really is going on?
Yeah, so once again, at the beginning of the pandemic, when there were so many unknowns, everybody was looking to different places for answers, explanations, solutions, and we were grateful, the dental world, for an article that the Times put out that really spoke to a lot of what we've just touched on. The neglect behind not going to the dentist and the fears and all that, but then also how, it could lead to bigger problems. And one of the biggest problems was this cracked tooth issue. People were cracking their teeth like you wouldn't believe because of this excessive stress and all the related, consequences of just letting things go. It could build up to bigger problems.
Okay, now I want to go through a session of debunking some myths. Thank you for sharing that. But a lot of people have their own reasons as to why they don't go to the dentist, right? Pandemic aside, people just are afraid. But let's debunk some of those myths that came into play once the pandemic started. Is it safe to go to the dentist during this pandemic? And if so, tell us why or why not. We know the answer, but tell us why or why not. We got to debunk it.
Okay, so I love saying the statistic. I don't know if I'm at the right numbers, but I'm close probably. I think you have a 0.3 chance of getting COVID in a dental office. It's just the facts. You're not going to get COVID inside an office that is following all the safety precautions because we do have protocols in place. You're not going to get exposed because you're not being put in an environment with maskless people around you. You are the only one without a mask if it's being done right. And often there are a lot of safety measures happening around you that you don't even see. Because guess what? I don't want COVID. My kids don't want COVID. Like, we want to keep ourselves protected and safe as well as our patients. So very unlikely that you will get COVID in your dental office.
Okay, now let's talk about some of these, some of the procedures, right? So dental surgery is still surgery. Can I get dental surgery? Is it safe to get dental surgery during this pandemic as well?
Yeah, so any of the dental procedures that maybe a dentist could, excuse me, recommend for you, it's basically the environment that you're in, right? So it's safe to get any particular procedure, surgery, a filling, a cleaning. It's not procedure specific. There are no pros and cons. At the beginning of the pandemic, we were limiting most dental offices, the procedures to emergency only. So only things like extractions, because the concern was, when you're getting like drilling done or cleaning, there's a lot of water spray. We call those aerosols. So at the beginning of the pandemic, we were all very concerned about these aerosol droplets that could potentially contain COVID and infect not only the air, me, the next person to come into the room, et cetera, but there's research that supports that we're okay. It's not likely to be an issue. But to your point, any procedure is just as safe.
Okay, myth, another myth, here we go. I should only go to the dentist for emergencies.
Mm.
Is that a myth?
Yeah.
Is that a fact?
Anybody who has that mentality, it's so unfortunate. You're doing yourself a disservice, because guess what? You would never have a dental emergency if you just come regularly, right? Like the emergency costs pain, the emergency costs more, right? Like it's more expensive to fix these emergency issues. And sometimes, it's aesthetic stuff. Like if you were preventive mindset, go regularly, do what I need to do to prevent those emergencies, doesn't it make more sense?
It makes more sense to me.
Yeah.
Now, myth or fact, I can only go to the dentist if I test negative for COVID-19.
If you've had, well, that has changed. Initially, yes, we did not see patients if they were positive, they needed to present a negative test. Now the protocol is if you test positive for COVID-19, then there's a waiting period. So our requirements are that it's like 2 weeks still. I know the CDC dropped it down to 3 days, whatever. Every office, though, you have to respect what your dentist does put into place. We are private practices. So private practices like mine, regardless of what the CDC might say, it's what we feel comfortable with.
Mhm.
So to that point, not always. You don't always need a negative test. It's just what the office policies are.
Okay. Some regular myths and or facts. I need to still wear a mask during my visit to the dentist.
My office, yes. We require masks everywhere except for when you're in the treatment room.
Yeah. And I think the rationale behind that myth or that fact is that they're going to be working on my mouth anyway. Why do I have to wear a mask? Mm-hmm.
Yeah.
Okay. And then last but not least, let's talk about how your office is taking precaution to make sure that you're safe and you're keeping your patients safe as well.
So once again, some of these things are obvious. The way we look, I've never worn an N95 mask before the pandemic. I know you guys have all seen these visuals of healthcare workers with these masks that really leave these marks and imprints. As I was getting ready today, I'm like, oh, I know they're going to see the lines because they stay with you for a good hour or two afterwards. It's not fun. It's unpleasant. It doesn't feel good. You can hardly breathe sometimes. But we know that works, right? So the N95 mask, all the PPE, covering ourselves pretty much head to toe and keeping ourselves safe and clean. Inside the rooms, the patients will see less stuff out, and I don't know, in the past, we've had like gloves out and, little cotton balls and all kinds, but we just keep everything away, cleaner surfaces, just just so that there's less opportunity for stuff to become contaminated. And then there are some things that you don't see. We have installed different air filtration systems. We installed some in the operatory itself. You might go to your dental office and see little machines, but that's to help kind of recycle the air, clean the air. And we also have ones that are, in the air conditioning and heating system above everything. So my point is, we are focused on not only the environment around you, how we're protected, but also the air quality. That was a big difference, a big thing that changed in the dental world, how we manage our air. Mm-hmm.
Love it, love it, love it. Serena is in the comments and she's saying, yay, you go, Doc. So she's giving you some applause. But can you point us in the direction of a website or somewhere where we can get more information as it comes out? Because like you were saying, some of the information may be outdated. Some of it may be changing. It's definitely fluid. So where can we go to get the most up-to-date information on COVID-19, the pandemic, and as it pertains to dentistry?
American Dental Association, I've been a member for over 20 years. And it is such a valuable organization, not only for us as dentists and professionals who are members, with information, with services that, you know, are really an advocacy for us in our profession, but it's a resource for the public as well. There's tabs that help the public understand a lot of the things that we've just chatted about. It also helps you find dental, you know, care, and there are different resources there that I do think could be helpful. And then just reaching out to your dental office. We have a ton of patients that call just for this kind of conversation. You know, if I can't be available, then one of my team members, and we really try to help our patients figure these things out, you know, that are, once again, a roadblock or an impediment from them receiving the care that they need.
I love that. American Dental Association, that will definitely give us some information. And then you brought up something that brought another question to mind. If I wanted to find another female African-American doctor, dentist, where would I go to find that? Like one of the commenters said, he flies from California to Harlem. That is obvious that you guys are far and few in between. So how do I find a Black dentist that's really good, 5-star service?
Yeah. You know, I wish I could just throw out a resource that was just, you know, because over the years, there've been different like networking groups, but the National Dental Association, that's another national organization for African-American dentists. And I think they probably have a directory and a resource for that. And yeah, that could be a good solution too.
Okay, so we got the National Dental Directory, and then we have the Dental Association.
National Dental Association. So that's the NDA, National, and then the ADA, American Dental Association.
Okay. Perfect. Now tell people where they can find you, just in case they want to fly in from Florida or Oregon. We don't know, just in case people want to fly in.
Right. So my office is in Harlem. We're in the Riverton on 135th and 5th. The office has been in the same location for over 60 years, and I've been here since 2005. So, you know, we're here. We're not going anywhere. Our website is under construction, but you could certainly find us on Instagram and, you know, and reach out.
Harlem Dental Associates on Instagram, is that it?
Yes, yes. And Google. Yeah.
And Google. Yes, absolutely. Well, it has been a pleasure. And if no one on Facebook has any other questions for Dr. Riordan, then we are going to bring this to a close. I'm giving the people on Facebook a couple of seconds to see if they have any questions. But if not, it has definitely been a pleasure. Thank you so much, Dr. Riordan, for myth busting with us and giving us the straight facts, letting us know where we can find more resources, and just sharing with our community. We definitely appreciate you.
Oh, I appreciate you. Thank you so much. Happy to be here.
Thank you so much. Talk to you soon.
Bye.
Bye-bye.